The dangers associated with the HIV pathogen have received a great deal of public attention. It is reported to have infected over 1 million people in the U.S. alone, and it continues to spread. Symptoms experienced at the onset of HIV infection can vary. They include weakness, fever, sore throat, nausea, headaches, diarrhea, and other flu-like symptoms. But many people with the HIV virus show no apparent symptoms for years after their initial infection. There is still no proven vaccine that can prevent HIV and no known cure. However, great strides have been made in treating HIV, and there are several drugs and drug combinations that appear to be effective in controlling the disease and relieving its symptoms in many people. People who contract HIV risk developing acquired immunodeficiency syndrome, AIDS, which attacks the immune system. This reduces the body's ability to fight off other diseases and as a result can ultimately be fatal. So controlling the HIV pathogen is very important. Hepatitis is a liver disease. It usually results in an inflammation of the liver and frequently progresses to more serious conditions including cirrhosis and cancer. Each year in the U.S., there are over 40,000 new cases of hepatitis B, the most common type of viral hepatitis. And it is estimated that more than 3 million people in the U.S. are carrying the hepatitis C virus. In fact, the prevalence of hepatitis is so widespread that many experts consider it to be a greater transmission hazard than HIV. While there is no known cure for hepatitis B, a vaccine is available that can prevent infection. In some cases, the same vaccine can be effective in preventing infection after exposure as well. Currently, there are also treatments that can help to control hepatitis B and relieve its symptoms. In recent years, there has been even more progress made in the treatment of hepatitis C. Today, there are drugs that can actually cure hepatitis C in many people. Hepatitis B symptoms can take 6 weeks to 6 months to develop. Symptoms of hepatitis C from 4 weeks to 3 months. The initial indications resemble those of a mild flu. There is a sense of fatigue, nausea, loss of appetite, and possible stomach pain. Often, jaundice, a distinct yellowing of the skin, will eventually develop, as well as a darkening of the urine.